Hi, beautiful people. How are ya? I hope you're having a great day.
With you, I can be sad with you. Just take my hand and fly up through the dreams where the skies are so clear.
Well, fatigue has set in my body today. And this morning, my granddaughter forgot to tell her mom that she needed 2 liters of 2-liter pop for a party at school in one of her classes. I love doing things for my grandkids. But when I feel like the energy has been sucked right out of my being, it's hard. But I did it. And since I got out of the house, I stopped at the Dollar General store and picked up a few items for our house. And then I dropped in at the Goodwill. I wanted to see if I could find a few summer tops. And I did. They're cute. I think they'll fit. We'll see. They're hanging drying, so if they work, I'll be wearing them in a future video. I just didn't have the energy to try them on there. Tomorrow, I'm hoping I'll wake up with a lot more energy than I did today. So I plan to clean out my bedroom closet again, just going through my clothes and seeing what fits and what doesn't, and reorganizing summer to winter clothes so I can actually see what I have. Since I lost weight, I have a lot of baggy clothes, and sometimes those are just what you need. They feel great. And yet other times I want to look, I don't know, pretty. Anybody else just like looking pretty once in a while? I had planned on washing my hair today, this morning, and that didn't happen. Mm-mm. So I touched it up with a flat iron, and this is what we got. When I went to put on my makeup, I grabbed my blush brush that I use to kind of make my blush more appealing when I put it on. I grabbed that brush instead of my eyeshadow brush. And by the time I was putting it on, I was like, why is this not working? So if my eyelids look funny, that's why. Two chronic pain conditions or disorders that are often diagnosed together are fibromyalgia and myofascial pain syndrome. They might be misdiagnosed as one or the other. Myofascial pain syndrome mainly involves muscle pain in specific areas. It's localized, meaning it may be in just a certain area, like the left side of your neck or the right shoulder blade. It isn't widespread throughout the body like fibromyalgia, but both can experience sleep problems as a result of all the symptoms. So, today, let's talk about the differences between the two conditions, fibromyalgia and myofascial pain syndrome. Here we go. In myofascial pain, tender, painful knots develop in the muscle. When pressure is placed in that area, deep aching muscle pain is felt that radiates outward. These are called trigger points. The fascia is involved, which can feel like aching, burning, stinging, or stabbing, but on a lesser degree than what might be experienced in fibromyalgia. Some people with myofascial pain syndrome will also have tension headaches, depression, sleep problems, and fatigue. Fascia is the sheath of connective tissue that surrounds wraps around all of our muscles and other structures in the body. It supports our organs, muscles, ligaments, tissues, nerves, joints, and bones. When fascia is healthy, it's flexible and stretches along with us. When the fascia is unhealthy, it tightens up and restricts movement, causing pain. It's made up of mostly collagen, and the fascia provides support and structure throughout the body. It holds muscles together. So when muscles are restricted by tight fascia and you move your body, friction or tears of the fascia can result. The environment that fascia creates allows all of our systems to work together. There are different types of fascia that lie deep in the tissues of the skin, whereas fibromyalgia involves the muscles but is widespread all over body pain, diffuse pain, and you will also have other symptoms such as headaches, bowel problems, fatigue, sleep issues, and many other symptoms. Fibromyalgia is chronic and the pain is migratory, called migratory phenomenon, meaning it moves from one area of the body to another and includes throbbing, aching, shooting, burning, stabbing, or sharp pain. And both the muscles and joints are involved. Does it feel like your joints are also involved in your pain with fibromyalgia? My ankle stiffness and locking of my ankles when trying to walk are a good example. But also, it feels like I have carpal tunnel and tendinitis because the soft tissues around our muscles also hurt, like our tendons. There's no redness or swelling like you get from inflammation, but it feels like it. It may be worse in the morning. It's believed that central nervous system dysfunction in nerve signaling is the cause of fibro. And in fibromyalgia, there are tender points, not to be misunderstood as trigger points. A tender point is usually near a joint, but not in the joint itself. Lifelong management of symptoms is often necessary, even though pain may wax and wane. In addition, most people with fibromyalgia and myofascial pain also have temporomandibular joint disorder, or TMJ. Many have crackling in the jaw joint right here, muscle stiffness, may grind their teeth at night, and also have tinnitus. And many also have osteoarthritis. Usually, myofascial pain syndrome is due to overuse of the muscle, like doing the same thing over and over, or it could be a lack of movement and staying in the same position over and over. It can also be due to emotional stress, a pinched nerve, poor posture, or working or living in a cold environment, or muscle injury, tendon or ligament injury, or a strain can cause it. Metabolic or hormonal problems associated with thyroid disease or diabetes related neuropathy, vitamin deficiencies, or the presence of chronic infections can also potentially cause it. It may be a central sensitization issue, just like in fibro, where the nervous system acts irregularly and alters pain signals even after the injury has healed. Inflammation and trauma can dry up the hyaluronan liquid. I didn't look up how to pronounce that. That is between the layer of fascia causing pain. My husband had myofascial pain after his car accident. He wasn't wearing his seatbelt. He always wears it now. And when he slid on the icy road and started to skid off the side of the road, he felt his Jeep start to roll. So he wrapped his arms around the steering wheel and hung on tight. Damage to the fascia in his chest area resulted, but initially he felt like he was having a heart attack. We made several trips to the ER, and finally, his doctor sent him to a neurologist, and he was diagnosed. Physical therapy helped, and it eased over time. He didn't experience cognitive issues, fatigue, or sleep issues like we have in fibro. And that's why they say myofascial pain can mimic other conditions. But in fibromyalgia, chronic pain may be due to genetics, environmental factors, or having an autoimmune illness or mental health condition. The pain is not due to injury or repetitive activity. It can be triggered by changes in temperature, stress, or hormones. A research review about fibromyalgia and myofascial pain titled Scoping Review and Interpretation of Myofascial Pain Fibromyalgia Syndrome, an attempt to assemble a medical puzzle, completed in 2022, showed that myofascial pain syndrome can develop into fibromyalgia through deranged myofibroblasts in connective tissue. And that was quite a large study. Myofibroblasts are activated in response to tissue injury to repair the tissue, but these can become deranged. That's how that study explained it. To me, that means crazy or insane. So that's not good. In fibro, we often experience issues with fascia. Inflamed fascia is what causes plantar fasciitis, myofascial pain syndrome, frozen shoulder, which I've had, and that's really painful, hernia, and Ehlers-Danlos syndrome. And I forget how to say that too. I'm sorry. Which many people with fibromyalgia experience. I did a video on that too. Myofascial pain occurs in about 85% of people sometime in their life. Myofascial pain is often misdiagnosed, underdiagnosed, or overlooked because it's hidden in another type of diagnosis like a headache, neck and shoulder pain, pelvic pain, limb pain, or nerve pain. The most common areas of myofascial pain are those affecting the neck and shoulder and the upper back. I know when I was getting massage regularly, she often found those painful knots in my upper back and would work them out. It was a hurt so good kind of a situation. I always felt better a couple of days later once she worked out all those knots. Neither of these conditions have any specific tests, but both are diagnosed clinically. In myofascial pain, the doctor will apply gentle pressure to the painful muscle while searching for tense areas. And of course, when they press on one of those trigger points, the result can be a muscle twitch or severe pain. The doctor may also want to do blood work to rule out other diseases before making a diagnosis. And this is the same for fibromyalgia. Many other disorders can mimic fibro, so those need to be ruled out. Then the doctor makes sure you meet all the criteria for fibromyalgia before a diagnosis is made. You can have fibromyalgia or myofascial pain syndrome, obviously, or they can co-occur or significantly overlap. Appropriate treatment for each condition is necessary, which I'll get into. In myofascial pain, muscle tightness can trigger your trigger points. Keep muscles loose by practicing calming meditation or reducing stress and anxiety. Some people will have myofascial pain that lasts less than 6 months, or it could be more than 6 months, which is a chronic condition. But it's important to note that the pain might resolve over time, too. Fibromyalgia, however, usually comes on slowly. It starts in one area and migrates until it's all over. It's a chronic condition. Do you have pain all over that moves around in your arms, legs, head, chest, back, abdomen, or buttocks that started without warning and came on slowly, moving from one area to another? Have you been diagnosed with fibromyalgia? Do you have specific pain in a specific area that radiates when touched, such as your neck or shoulder that started after an injury? Have you been diagnosed with myofascial pain? Or do you have both? Myofascial pain may resolve with treatment, such as targeting those trigger points with laser therapy, needles, or massage. Treating the underlying cause of myofascial pain may help prevent the condition from recurring. Otherwise, it can become chronic. Non-steroidal anti-inflammatory drugs or NSAIDs like ibuprofen or aspirin are often used, and you might find lidocaine patches or creams helpful. Antidepressants or muscle relaxants that help muscles relax and relieve sleep problems can also help. It's also known that many people with myofascial pain have inadequate vitamin levels, so ask your doctor to check your vitamins and minerals. The key players are vitamins A, B1, B2, B3, B5, B6, B12, C, D, E, K, biotin, folic acid, potassium, sodium, calcium, iron, and zinc. Vitamin B12 and folic acid inadequacy are more strongly related to chronic myofascial pain syndromes. An integrative approach to treatment is recommended, like vitamin supplementation and massage to work out the knots. Fibromyalgia is a long-term condition, but treatments such as medications, exercise, CBT, and stress management may help people manage their symptoms. I've done a lot of research and produced a lot of videos on this subject. I hope you'll check them out. I hope you learned something. I send you gentle hugs and support. Love you. Oh, oh my God. Oh my God. One of those big jumping spiders. One of those big, brownish, black looking, scary spiders.